Hello and welcome to our first weekly video blog that will be solely focused on dementia. We will be discussing different types of dementia, the evaluation, treatment, the impact dementia has had on the healthcare system, and also tips on staging, tips for the caregiver, tips for sundowning behaviors. So we're going to cover every single week a different topic that is not only going to help you as the clinician, but also be targeted as the caregiver themselves. Also, we'll be talking a lot about prevention and some of the recent literature that's come out on how we can help prevent Alzheimer's disease. My name is Dr. David Hutchings. I am a neuropathologist, and I'm also the Chief Operating Officer for Spectramed. Spectramed is a family-owned organization that is designed to provide clinical resources for medical resources, but also rehabilitation resources, as well as clinical programs to improve patient outcomes. So the purpose of the weekly blog is for us to dive into dementia little by little every single week. What we're having basically is, what we have is an epidemic. Dementia is simply an epidemic. And if we look at the statistics on dementia as a whole, we can see that the epidemic is already here. In fact, if you're listening to this, 1 out of 2 patients by the age of 80 will develop some form of dementia. So the chances are either you're going to have the condition or you'll be caring for somebody that does. So let's get started. Where do we begin with this? So first, let's discuss what is dementia and also the impact so far just on the prevalence and statistics of the condition. If we look at the baby boomers, right, they're already here, all right? We have baby boomers right now statistically at 7,918 people every single day that are turning 65. That's mathematically 330 people per hour. So if we look at what that kind of boom in terms of the baby boomers and people that are now aging, what we see is that is kind of the silver tsunami. That's what we call the silver tsunami. But right there with it is what we call the gray tsunami. So if we have 7,918 people every day turning 65, we have a diagnosis of Alzheimer's disease every 71 seconds. And by the time we reach the mid-century, so 2050, which is right around the corner, that is supposed to increase to every 33 seconds. That is only for Alzheimer's disease. There are about 85 different forms of dementia. And in this weekly blog, we're going to be discussing these different types of dementia and how to identify and differentiate which ones. And what makes it harder too is that these conditions many times will mix. So many patients don't have one form of dementia, they have multiple. And the treatment is not always the same. So if we kind of break down what is dementia, basically, when we look at a disease, we define a disease by one of two things. Either it impairs your ability to take care of yourself, or it impairs your ability to take care of someone else. And dementia does both. So if we can think about dementia as an umbrella term, and I will use cancer for an example. When we look at cancer, you have cancer as an umbrella, then you have many different forms of cancer that fall under that. Dementia is the same way. We always associate Alzheimer's disease as being, and that's one of the most common questions I get from my patients are, what's the difference in dementia and Alzheimer's disease? Well, dementia is your umbrella diagnosis, and then you have Alzheimer's disease, which makes up the majority of the cases. Around 70% of all dementias are Alzheimer's. But most people don't know that there are many different forms of Alzheimer's too, which we'll be discussing that as well. One of the biggest concerns for all of us, and it is the greatest fear. I have dementia in my family, and so certainly it is a fear of mine. My wife, she has dementia in her family as well, am I going to get this? So I'll first start out by saying that, again, later we'll go in more into genetics, but I'll first start out by saying dementia is not always genetic, and Alzheimer's disease is not always genetic. And we're going to get into the genetic mutations and how the plaques and how the tangles and these things start to occur. So as we begin this journey of our weekly video blog on dementia, it is my goal to be able to educate what is this condition, how do we treat it, And also, it's not, if you're when you're listening to this, you may be thinking, yes, I'm the practitioner. I need tools for behaviors. I need tools for diagnosis, evaluation, staging. What do the medications do? What about the vaccinations that are out there? So I want to be covering all this. But for now, let's start off that we have a gray tsunami of a diagnosis of one form of 85 different types of dementia every 71 seconds. So we have to be able to be in front of this condition. We are on the brink of healthcare as being the most advanced it's ever been in terms of technology. But the frightening thing is, the first dementia patient ever recorded, her name was Augusta Dieter. And Dr. Alzheimer's knew that there was something wrong with her, but he didn't know how to care for her. She lost all mental and cognitive and physical abilities, and she later passed away. That was 115 years ago. And 115 years ago, Dr. Alzheimer's disease did an autopsy on Augusta Dieter's brain, and he found these weird plaques and tangles that he documented. So we're going to talk more about that. The hardest thing for me as I evaluate and diagnose this condition is that if I had Augusta Dieter now as one of my patients 115 years later, I would provide absolutely very little different treatment than Dr. Alzheimer's did 115 years ago. So as we begin this journey, I hope that this video blog is going to be extremely educational to the condition. As I mentioned, we're going to be talking about a variety of different topics every single week that are not just geared towards you, the healthcare practitioner, but also to the caregiver. Again, my name is Dr. David Hutchings. I'm very excited about this opportunity that Spectramed has given me to be able to share with you some of the knowledge that I have, and I'll also be providing very specific patient examples of current patients of mine. That's also going to help, again, you, the healthcare practitioner, but this is something that we are all facing. So I'm very excited about the video blog, and you'll be seeing me hopefully every single week. Thank you again.